welcome back to another episode of NalaTalk, where we discuss updates in the field of genetics and especially its implementation in clinical settings. And today, you'll have me as your host, Dr. Esther, one of the doctors here at Nalagenetics, and we are very thrilled to have Emilia Achmadi. She is a very renowned and very experienced, seasoned dietitian. And we will talk to her about nutrigenetics and its application in the clinical settings as well. Hello, Bu Em. Thanks so much for joining us.
Yes, my pleasure.
Yeah, it was very cozy there as well.
I know, yeah. Nobody's here. I let everybody know.
Thanks so much for blocking everybody for us. So maybe just a little bit of introduction for all of our viewers who might not know gitu ya. Em, if I can call you that.
Of course.
It's a graduate of Oklahoma State University. So you took Bachelor of Science, Nutritional Science, and Master of Science from Oklahoma, and after that you had 25 plus experience in the field of nutrition, consulting various different organizations gitu ya. So I'm just interested to know, maybe you can elaborate a little bit more about your background gitu, and how you got interested in the fields of nutrition in the first place.
All right, thank you, Esther. Well, you know what makes me interested in nutrition is quite simple. I love to eat. So that's the main reason. Jadi when I was young, a lot of people said, oh nanti kalau udah tua, kamu nggak boleh makan segitu banyak lagi ya. You have to pick and choose what you eat. So I'm saying to myself, oh no, I'm not gonna stop eating the things that I like. So my mind was saying to me like, okay, there must be a secret here. There must be a way. Karena nggak make sense. Some enjoyment in life has to be limited and has to be stopped. When you enter a certain age. So that's the reason kenapa I actually interested in the field of nutrition, because I just want to know the secret. Because once you know the secret, you can strategize. So that's the way my mind was working. So itu sih alasannya in the beginning. So just so happen I love to eat, but I also love science. I love anything that is, working with data, and then, you can prove something and disprove something. So that's the beginning. And then just so happened I got a scholarship from a foundation in Singapore. So I can pick and choose what I want to study. So I study human nutrition and clinical dietetics, because I think that is the field that nobody ever think back then, because this is in 80s. All right.
Yeah.
Way back when people don't even care about what they put in their mouth, right? So I think it was that interest yang membuat saya, I want to try something new, something that I love, and something that I want to know anyway. So that's actually the very beginning of my interests. Gitu.
Yeah. Well, yeah, because I feel like sometimes when you just started, trying to choose a path for your higher education, it can be difficult to choose from so many different options. Gitu ya. Tapi sounds like you found the field that you're really interested in, and it is on the intersection between that science and your love for food. So that's amazing. And after that, so you worked for a little bit, in the US, and then you went back to Indo. Can you maybe tell a little bit more about how that experience was?
Yes. So because I chose a research-based university. So it was in Oklahoma State, or Oklahoma University, and then I ended up in UT Austin. So they actually provide me with internship in the beginning, right? So I enjoy the environment and the fact that the world of nutrition is so much more established in US. So I got the experience of doing so many things. I did a little bit of lab research kind of job, which I love. I don't like to talk to people back then. I love the quiet, and then working by myself. So I experienced that. But I also get an opportunity to engage in community nutrition program. So I assist, reservation. I'm in Oklahoma, Texas, a lot of Indian reservation, right? So I did a little bit of work there. Assisting new mother, preparing for breastfeeding and things like that. And I was involved also in in helping elderly people. So I actually touch base with gerontology,
Yes.
seeing the elderly live by themselves and pick and choose the food that's easy to digest and is easy for them to chew, things like that. And towards the end, actually, I had the opportunity to work with National Football League. So I'm a football
Wow.
so,
Are you? Oh, wow.
I mean, I love football up until now. My two girls always said, "Ma, when it's football season, you are not you anymore." Because I just
Become someone else.
yes. So I was involved in a program, a collaboration between Dallas Cowboys back then with UT Austin.
Wow, that's awesome.
Yeah. So I was involved there also. That's actually the beginning of my love in terms of sport nutrition, because then I realized that, hey, nutrition is not a matter of keeping yourself healthy or managing your disease, but actually, if you know the secret, you can use nutrition to increase your performance. So that's something that is very attractive to me. So yeah, I bits and pieces when I was in the US, and I returned to Jakarta, to Indonesia, thinking that everybody will be excited with what I am doing, because way back in 1995, I think, when I returned to Jakarta, and everybody giving me the look like, what are you?
What do you do?
Like, why do you want to do that? And then,
Right.
so that, it was an interesting part of my life.
Yeah, wow. I mean, it's so interesting to hear like a wide variety of different client bases that you work with. And how is it? Of course, as you mentioned before, it was very new when you first came to Indonesia.
Yeah.
And how do you think like it has developed from the first time when you came back until now? Like it seems like people are very aware, and these days, people are very into eating healthy and developing sort of healthy lifestyle.
You know what? It's interesting to see how people change, how a country change, how a community change. So again, back in 1995, I almost feel like I don't have any value because I present myself in the hospital setting, and they're not really interested in what I do, like, we have nurses for that, so we don't need you. So I was sort of like, oh, okay, I'm just going to go back to US. But anyway,
Yeah.
Either I give up or I create my own market. I create my profession, basically. So that's why I stayed back, and I started with building small companies. Like, I'm giving services to people who want to know. Obviously, the first clientele are coming from people who are sick, people who went through chemotherapy, who had kidney failure. It came from that population. But as time goes by, actually people are start to, okay, you know what, now I got it, I have to have an ideal weight so I don't get sick. So the weight loss, weight gain, or ideal weight becomes important, becomes popular, and people are start consulting with me for that. But like you said, I think Indonesian people are start to not being ignorant anymore regarding the things that they put in their mouths. And I always said, it's not a cliche when you said, you are what you eat. I mean, seriously, if you eat garbage, you expect what? I mean, your body will
absolutely
give you, right? So, so it starts from there. And as I think about around 15 years ago, people start to become more engaging when I said about prevention. I mean, you can prevent diabetes, just because you have a history in your family, that doesn't mean you will get it, but there are some changes that you have to do. So around 15 years ago, I started developing my own company. I provide these services to corporation. It started with foreign corporation who actually concerned with their employees' health issues, right? So basically now my clientele is from all kind of population, I should say, like a corporation setting, where a company wants to give back or wants to retain their employee and give added benefit by providing me to help them to live healthy. But then again, the company knows if employee gets sick, they're the one who have to pay, right? Right?
Yeah, wow.
So
they're very forward thinking.
Yeah,
like,
forward thinking. Like, I don't want you get sick, So anyway, I start with that, and then the fitness club, and then for the last, say, 8 years, I'm working very closely with athletes. So like a lot of sport federation, the government. I got involved in a program for Olympic 2016.
Wow.
Games, Asian games. So, like a variety now. And yeah, it's getting more and more popular. Yay!
Yeah. No, it's so interesting. I mean, I can talk to you all day about it. It sounds like it also gives a lot of room for you to be creative and, with innovation as well. Because if you're doing the same thing over and over again, it can get a bit boring, but like, sounds like there's so many things that you can work with and so many different sort of personalized needs as well that can be addressed. So you've had years and years of experience interacting with clients, and I'm just curious to find out what are maybe the top 3 challenges that you saw so far that were brought up to your attention.
Yes, I mean, definitely. I think the fact that a lot of people are used to this way of thinking of I want to get result fast, in being instant, instant generation. I think my first challenge is actually making people to understand that staying healthy demand that discipline, that, doing the same thing, the right thing every single day. And also that it is a progress. It is a process. I mean, you can't be something new or something better in a blink of an eye, So I think the concept of that process is my number one challenge. And then also the number 2 challenge, and this is also, I think, what happened is people are just don't value their health when they're healthy. So they always take it lightly. Oh, you know what? Nanti aja deh. I'm still young. I want to enjoy my life. I always said, well, because you want to enjoy your life for as long as you can, you have to start planning. So I think that is the challenge number 2 that I've seen. A lot of people are not really caring about who they are or their health at the moment until they get sick. So that's the number 2 challenge. The number 3 challenge for some years, I feel like the lack of a complete assessment. I mean, as a doctor, we realize how can you prescribe something or how come you create a program when you don't know who you're talking to, 100%. I think the importance of assessment is undervalued here. Here being not only in Indonesia, everywhere in the world, I mean, to me, assessment, your program can only be as good as accurate as the assessment. If you don't have assessment, I mean, I always use the same analogy. Like if someone asks me, aduh jalan ke Bandung lewat mana ya? Then I would ask, where the heck are you?
Yeah, exactly. To meet them where they are at. Yeah.
Exactly. So I think assessment is a challenge. That's why, I always trying to find a different way of creating a complete assessment for my client before I even start anything. So those are the 3 challenges that I found so far. Yeah.
Yeah. No, thanks so much for the insight. Yeah, I think it's really important, and I'm glad that you brought it up, that people expect really instant results. In fact, if you want lasting changes, you need to be consistent with the small changes that you can make, and then cut to a few months later, you'll find that, oh my God, like look at all the things that have changed, and it just started with one small thing, isn't it?
Yes.
And you mentioned assessment as well. I'm just curious to know, like, what are some of the tools that you found useful so far, being a dietitian for sort of personal assessment, and where like nutrigenetics maybe fit into the picture, if at all you find it useful.
Right. So I was introduced with a different way to assess someone. So in the beginning, I rely on two assessments. The body composition analysis for me is important, but I always underline to all of my clients, you can't just use a cheapo service, body composition, because
Yep.
when you use something that is less accurate because of the pricing, then you get an not as accurate result, and it's even worse than not test, right? So
Yeah.
body composition for me is a tool that is so much helpful. I can see their bone density. I can see the composition, or the ratio between lean muscle mass, percent body fat, where the fat are. Is it focusing in the stomach, visceral fat, subcutaneous fat? Body composition is it's such a help for me.
Yeah.
The second one is actually the organ function. So medical blood tests is actually super important. I need to understand someone's energy system. I need to understand if they have metabolic disorder already. Lifestyle now are changing, right? I mean, less active, foods are more high density calorie, more processed, things like that. So I like to see their profile, the lipid profile, how they manage their blood sugar, the liver function, the kidney function, the inflammation level. So blood test is actually, for me, it's a must before I handle someone. But since I think, I did my DNA test years back, more than 10 years ago when I was in US, again, and it was expensive back then. Now I feel like DNA tests as something that is super important. Really, again, as I said before, your program can only be as good as the assessment. So I've seen for the last 5 years since I actually recommending DNA tests, I can actually develop a super accurate individual program. So it's no longer trial and error, no longer a confusion between, oh my God, do I have to eliminate carbohydrate? Oh my God, do I need to be a vegan? Oh my God, this and that, supplementation, da da da. Nothing is good or bad, but everything is according to who you are. If you know what I mean, right? I mean, it's not that do I need to be do I need to lessen my animal products, animal protein products? Well, it depends on who you are, it depends on your body, it depends how you manage that, and how the digestion, the absorption, etc., etc. So I think now DNA tests related to nutrition is the tools, the assessment. I would say to a lot of people, to everyone who wants to listen to me, to all of my clients, if you want me to handle you, I want you to do A, B, C, and A is always DNA test. And if they said, well, you know what, it's slightly more costly, and I remind them, you know what, to maintain your health, it's never free. You have to invest, right? And bear in mind, DNA tests you only do once in your life, because your DNA won't ever change, right? So really, it's expensive or it's costly. It takes more investment. Yeah, sure, but put it in the right perspective. It will help you navigate your minuses. If you have that link from the past for diabetes, by knowing that, you can strategize from now, right? Seeing what you need to limit, seeing what you need to increase, and that way, by knowing, I feel a feeling of freedom. I know who I am. I can navigate. I can strategize. So once in a while, if I eat my donuts, heck, I don't have to feel guilty about it. It's in the plan, and that's the whole thing about my program. I never want to make people live a bad life. Eliminating so many things. Oh, nggak boleh makan gorengan. Oh, nggak boleh. But let's see first. Let's see how extreme you need to be. It depends. in some situation, you don't need to. You just have to use that 80-20 rules, right? Like you have to eat healthy most of the time when you can. And then once in a while you let loose and you enjoy, with friends, celebration, whatever. And you don't have to feel guilty about it. And I don't believe in guilty pleasure. There's no guilty pleasure. It's either pleasure or pleasure, but more pleasure because So yeah, I'm so thankful that the technology now allowing us to sort of pick through yourself and see the blueprint of who you are, and that way you can live your life as free as you want, but being responsible at the same time. So that's for DNA test.
No, I really like that. I mean, it just allows us with the advancement of technology, new things come up every year. And now, like you said before, you can have it personalized to each individual patient and to help them better understand themselves, because obviously the approach that might work for A might not work for B, right?
Yes.
And I really like the fact that you brought up, like not to have the mentality, oh my God, just like freaking out over each and every calorie or over like bad food, right? But just having that kind of label is not helpful for people as well, and they can't really enjoy life, enjoy food, and in fact, like I think they will spiral even more. Like, oh my God, like I already ate something bad today, might as well, just like spiral, and that doesn't do them a service. And so I'm curious as also to know like what how has the response been like since you incorporated this more sort of personalized approach, and were people surprised that actually their genetics have to do with how they process food or nutrients?
Oh, definitely, they're surprised that they can actually like really. Gue bisa tahu if I can drink coffee and not drink coffee, and how much coffee you can drink. I said, yeah, because I myself, when I did my complete DNA test, say the latest one is because more strain are being tested. It's actually about 5 years ago, and I found out that I do have sensitivity towards caffeine, and I love my coffee. But instead of like I'm like, oh no, I can't drink coffee. It changed the way I look into my coffee. So now I really pay attention on the quality of the beans, on how I brew my beans, So if I go to a coffee shop and this is a brand new coffee shop that I've never tried before, and then I sip the coffee. If it's good, I drink it. If it's bad, then I put it back. I'm not going to waste my allocation with something that is not as good,
Yeah.
So the way I see it, I think my clients are surprised that, oh my God, I can actually know specifically when I do my grocery that I have to focus on this veggie because I have a problem in digesting, absorbing, say, vitamin A. So I recommend a lot of carrots, the dark greens, and then the pumpkins, and then eating. And some people are surprised also by looking at their DNA test that I can actually say to a certain, almost 100% that you can't be a vegan, for example, because they have issue in iron, they have issue in B12, and we know those micronutrition are very richly in animal products, So definitely my client who actually doing DNA tests and then look into their result are more compliant to the program. Because I said to them, this is your result. This is not me saying you cannot do ABC. This is your own body telling you through me that you cannot do ABC, So I think I think DNA test is just like blood tests, say 15 years ago. People do not do blood tests regularly until they get sick. That was like, 15, 20 years ago. So right now, I think DNA test is pretty new. We have the responsibility to educate people and position this DNA test. It's not something luxurious. It's not something that you do because it's a trend. No. This is a basic needs, if you want to prevent that disease. And I always said, when people said, "Oh, it's expensive." Hey, how much your iPhone costs?
Very true.
Right?
Yeah.
And every series you keep up. And you do financing, easy pay, whatever, you do that for an iPhone and you won't do that to your own body.
Yeah.
I think education is the key. So a lot of my clients who are been preached by me about this DNA, and they actually, doing it and then get the result. And I created a program, and the program works. And they were just like, "Oh my God, you are right. I no longer have to do trial and error. It's actually giving me the result that I want." So I see this as a way of spreading a good news, because people who are happy with the program, they will talk, right?
Yeah. Yeah.
I'm very happy with how my clients are reacting to this DNA test. Actually, now more and more corporate clients are looking into this, because because I do a lot of corporate wellness program. So I've been talking to the top management that, hey, if you want to reduce your costs, your medical costs, your insurance costs, you want to increase productivity, you want to increase or you reduce the turnover of your employee, and they stay loyal to you, is by providing this, as a way of saying, I care.
Yeah.
I want to save you.
Yeah.
They're very happy once they understand. I don't think any right mind person will reject the NHS. I just have to say that.
Yeah. It's fascinating. I mean, I would love to talk, to you more about it for hours, but I think keeping mindful of the time, I also know I need to let you go. You're a very, very busy woman.
We can have new episodes later on with different topics, right? So don't worry.
Amazing.
Yes.
Amazing. I'm down for it. I just want to say thank you so much for sharing your wisdom with us today. I mean, there's so many things that we can talk about more, but maybe like in later episodes, is what you said. But I really, I'm really glad that you brought up, the fact that prevention is key, and that starts with nutrition, and just knowing the best type of nutrition that works for your body can be aided by a DNA test. That's what you've implemented so far as well. So I hope that people who are listening can take away something from today's episode. And we will see you in later episodes of NalaTalk, bringing you more updates on the fields of nutrigenetics. See ya. Bye.
Bye.